So a little background, BXCL701 is an oral dipeptidyl peptidase and FAP inhibitor. In this study, Phase II study, we're combining with Pembrolizumab in patients with second-line metastatic pancreatic ductal adenocarcinoma. This regimen is quite well tolerated. BXCL701 is associated with hypotension and anemia. We do start at a lower dose for the first week to exclude patients with low baseline blood pressures, to start them at a lower dose. But aside from 2 patients, we've really been able to treat everybody at the full dose, and even at the lower dose, nobody's had any significant issues with hypotension or anemia, which is another known side effect of BXCL701. One side effect we have seen in 2 patients who were treated for beyond 6 months was immune-related arthralgias and arthritis, one of whom did require corticosteroids, the other did not. But otherwise, we haven't seen significant adverse events. The regimen's been quite well tolerated, and normal side effects that one would see with drugs like Pembrolizumab. The goal of this study, the primary objective, was disease stability, so progression-free survival at 18 weeks, so the second 9-week scan. We're also incorporating pre and on-treatment biopsies to do a lot of correlative science associated with this study. We've seen that 4 out of 16 evaluable patients have had stable disease or better at the 18-week scan. It's assignment 2-stage design, so we're aiming to have at least 7 out of the first 19 evaluable patients. Of the patients we've analyzed who are evaluable so far, the response rate's been 17%. One of those patients was MSI high, so the MSS response rate is 12%, with a disease control rate around 40%. So this has been, quite striking in a patient population where we don't expect to see, really much activity of pembrolizumab by itself, including 3 patients who have had stable disease or better for 6 months or beyond. Median progression-free survival is 2.3 months. Overall survival not yet reached. Again, this is an actively ongoing study where we're also hoping to gain a lot from the correlative scientific analysis.